You know, there are few things that can make a parent's heart draw quite like seeing a sick child who suddenly has a strange rush. Today, we're going to break down one of the most common and, honestly, one of the most confusing culprits, those tiny red spots. We're going to get into what they mean, when you really need to worry, and what you absolutely have to know. So, picture this. It's the middle of the night, your toddler's got a fever, you've been managing it, but then you notice these little pinprick dots on their skin. You do the glass test, you press it against them, and they don't fade. And your heart just starts pounding, right? What on earth does this mean? What do you do next? And look, this isn't just some made-up story. We're actually going to follow a real-life case of a 3-year-old boy who was brought right into the emergency room with this exact same combination of symptoms. His story is the perfect way to understand what doctors are looking for when they see these spots. Okay, so what are we looking at here? He's a 3-year-old boy. He's had a low-grade fever for about a week with one spike. He's got a sore throat. But here's a detail that's really, really important. The doctors noted he was in a good general state of health. And of course, there are the spots. They're tiny, just a millimeter across, showing up on his ears and neck. Okay, so before we can even begin to solve this little mystery, we've got to understand what we're looking at. What are these dots, and why do doctors pay such close attention to them? Let's decode the dots. The official medical term for these spots is petechia. Basically, they're super tiny, flat spots caused by a little bit of bleeding from the smallest blood vessels, the capillaries, right under the skin. And here's the key thing for any parent, the thing you'll probably try at home: they don't go away when you press on them. That simple test, it's a crucial first step. Now, when it comes to these spots, size really, really matters. If they're tiny, like 2 millimeters or less, we call them petechia. But if they're bigger than that, they're called purpura. And that distinction, it's a really big deal because those larger spots can point to a more significant problem. In our case, though, we're talking about the little guys, petechia. So what causes these things? Well, when you see a list of causes, it can look pretty scary, I get it. But here's the key thing to take away. Yeah, serious bacterial infections are on that list, but so are some really common everyday things. A really bad coughing fit or a bout of vomiting can cause them. And a huge, huge category, just simple viral infections. This is a vital piece of our puzzle. All right, now we are getting to the absolute heart of the matter. When a doctor sees a child with petechiae, their entire thought process, their whole evaluation, it all pivots on the answer to one single question. This is the critical turning point. Is there a fever? That's it. Seriously, that is the question. It separates the situations that are probably okay from the ones that need immediate serious attention. The answer to this one question sends the doctor down 2 completely different roads. So if the answer is no, there's no fever, the doctor's brain goes down one path. They start looking closely at the spots themselves. Are they just on the upper body? Maybe after a really bad coughing fit? That's usually pretty reassuring. But are they all over the place? Maybe with other bruises? Well, that points towards a whole different set of tests, looking for things like blood disorders. But what if the answer is yes? Our 3-year-old boy did have a fever. And when you have fever and petechiae together, everything changes. The doctor's focus immediately snaps to looking for a very specific set of urgent warning signs. Okay, listen up, because this right here, this is probably the most important thing you'll take away from this whole explainer. These are the red flags. These are the signs that tell a doctor and tell you that this is not a wait-and-see situation. This is a potential emergency. See, it's not just about the spots anymore. It's about the whole picture. Is the child just not acting right? Are they incredibly sleepy and hard to wake or way more irritable than usual? Do they complain of a stiff neck or severe pain in their arms or legs? Are the spots getting bigger, turning into purpura, or spreading like wildfire? Is the child under 2? These are the exact signs doctors are looking for to rule out the scariest stuff, like sepsis or meningitis. All right, so now that we have that crucial checklist, let's head back to the ER with our 3-year-old boy and see exactly how the doctors used this framework to figure out what was going on. The doctors basically went right down the list. Let's do it with them. Was his state altered? Nope, the report said good general state. Did he have a stiff neck? No, the tests for meningitis signs were negative. Were the spots bigger than 2 millimeters? No, they were those tiny 1 millimeter petechia. And was he under 2? Nope, he was 3. See? He wasn't ticking any of those major red flag boxes. So, because the physical exam was so reassuring and none of those big, scary alarm bells were going off, the doctors could take a breath and proceed calmly to the next logical step. A simple blood test could give them a bit more information and help confirm what they were already thinking. And what was the final verdict? The blood work came back mostly normal. And the final diagnosis was viriasis, which is just a general term for an illness caused by a virus. It turned out to be one of the most common and least frightening causes on our list. The fever and spots were just his little body's way of fighting off a common bug.
Okay, so let's boil all of this down. What's the bottom line here? What are the most important things you really need to remember from all this? Let's get right to the essentials.
First, these spots are common, and a lot of the time they're caused by something simple, like a virus. Second, that fever, it's the absolute game changer. It's the most critical piece of the puzzle. Third, knowing those red flags, that's your power. That's what helps you tell the difference between I'm worried and this is a true emergency. And finally, nothing replaces a doctor actually putting their hands on your child and doing a full exam. And this leads to maybe the most critical piece of advice, and it's pulled right from the source material we looked at. It means that even if your child has already been seen by a doctor, if something changes, if they get sleepier, the spot starts spreading, or any new worrying symptom appears, you have to get them checked out again. Always trust your gut. Ultimately, what this is all about is empowerment. This information isn't so you can diagnose your child from your living room. No way. It's so you know the signs that separate I'm feeling anxious from we need to go right now. This knowledge is about helping you stay calm and make the right call. The real question is, how can you use this to make that call with confidence when it really matters?